Now let's get started. Thank you all for joining LIRS for this town hall, entitled Serving Migrants and Refugees in the Time of Pandemic. My name is Kristen Whitty, and I am the Director for Outreach for LIRS. Let us begin together in prayer. Source of all life and healing, we stand before you as a united people of hope, one human family, trusting in your care and protection. May we be strengthened by your love in these anxious times of physical, emotional, and spiritual need. Help us cope with the challenges that we're facing. Comfort those whose lives have been unsettled, disrupted, and permanently altered by illness. Calm our frantic thoughts and fill our despairing hearts with joy and strength. When we feel sickness or the fear of tomorrow, we'll remember to celebrate the beautiful gifts you have given us in this present moment. For light and hope as we walk in this darkness. For patience and for understanding. For strength and for wisdom. For healing and for inner peace. In gratitude, we pray. It is my pleasure to now welcome Krish O'Mara Vignarajah, CEO and President of Lutheran Immigration and Refugee Service.
First and foremost, I want to thank each and every one of you for taking the time out of your day to join us. I think it says something incredible about our supporters that even at this time of great uncertainty, you all are thinking about others. I know a lot of you are juggling new challenges, whether it's working from home, trying to work from home while caring for kids, taking care of your parents or your neighbors. As a working mother of a precocious 2-year-old, I know that this situation has its fair share of complications, especially when you're on a video conference call. I've told my staff not to apologize when children or furry friends pop up on screens, so I won't say sorry, but just preview that my daughter may make an unscheduled appearance during today's session. I am so humbled that you all have found the time to join us to learn about how this crisis is impacting refugees, asylum seekers, and other immigrants in our communities. I am so grateful for you to be here to learn more, maybe even to look for ways to help. So I'll begin by stating the obvious. These are very trying times for our migrant brothers and sisters. 93% of the world lives in countries with travel restrictions now, including 30 with no exceptions for asylum seekers. It's heartbreaking to know that refugee families abroad will remain in harm's way as the UN suspends all resettlement flights for the time being. Perhaps a necessary step, but heartbreaking nevertheless. Even before the coronavirus here in the United States, we've been in the midst of what has felt like a war on immigration and immigrants. Today's public health crisis and now economic recession has just added insult to injury. These are trying times for refugees who've just arrived in the United States, and it's especially difficult for them to find work in the typical industries where they find their first job. These are also trying times for the thousands of asylum seekers who are being held in detention facilities across the country, facilities that are ill-equipped and notorious for conditions that ease the spread of disease. And these are very trying times for unaccompanied children at our southern border, desperate to reunite with a family member or a sponsor in the US. The administration's emergency closure of the border means that all migrants, including children, will be immediately returned to Mexico without any semblance of due process. It was recently reported that Customs and Border Patrol is expeditiously removing them to Mexico at an average rate of just 96 minutes. Our team will go into these issues in depth, but if it's helpful, I want you to know that I remain hopeful. Yes, LIRS personnel are now working remotely, but each and every one of us is even more committed to serving our immigrant friends. Our programs team has worked nights, weekends for as long as it takes to support our clients through this crisis. Our advocacy team has been working around the clock to lobby Congress on behalf of the most vulnerable. Our entire organization has mobilized to create a campaign and resources to help migrants in detention. And you, our supporters, have sent countless messages asking how you can be of assistance. That's what inspires me. It's what gives me so much hope, knowing that we are not alone in this struggle. Knowing that there are passionate, dedicated men and women across this nation that want to give voice to the voiceless. Even though we may be physically apart, thanks to your compassion and enthusiasm for this mission, I have never felt closer or more connected with everyone. Truly, thank you. Thank you for your support. And thank you for your willingness to take action on behalf of refugees, asylum seekers, and immigrants. And with that, let me give a quick overview of today's agenda. We'll begin with our programs team, who will go over the impact of the pandemic and the state of affairs for our clients. Our advocacy team will focus on the government's response to the crisis as it relates to immigrants and what you can do to help. And our communications team will talk about our newest campaign to help our friends in detention and other ways to stay connected to this work. So once again, thank you. Thank you for your support, and over to programs.
Great. So hi, everybody. I'm Megan Bracey, and I'm the Director for Refugee and Migrant Services here.
And I'm Lori Davidson. I'm the Director for Children and Family Services.
At LIRS, we work through an extraordinary array of direct service providers around the United States who provide welcome and respite to refugees and migrants in need. The people that I have the privilege to work with are passionate about their work, and when a crisis like this hits us, our instincts tell us to run into the burning building, not to shy away from the challenge.
Yeah, and like Megan said with the refugees, we in Children and Family Services also run into the challenge, and we're continuing to offer transitional foster care, long-term foster care, and community-based follow-up services for unaccompanied children and their families. We are also committed to providing services for unaccompanied refugee minors. So even in this time of a health crisis, we continue to reunify and strengthen families.
So this particular challenge of COVID-19 has been really, really hard on our community. And refugees and migrant clients have been hit especially hard. For a new refugee like Henry, this crisis causes so much distress and difficulty for his family. Having recently arrived with his wife and 6 children from the DRC in Africa, he was happy to secure his first job at a local hotel. But due to the COVID-19 pandemic, the hotel has temporarily closed down and laid off most of their employees. With the help of our local office, Henry has attempted to apply for unemployment insurance, but due to the high demand, he has yet to get through. LIRS has been able to support with some emergency funds to help delay and postpone any kind of homelessness that he and his family might be facing, but the family and us are very concerned about how they will survive this. For another family of young adult siblings living in Phoenix, Arizona, this has hit them especially hard. They're just trying to hold their family and lives together, while their mother and father have been held in immigration detention centers for the past 2 years. Because of COVID-19, 2 of the 3 siblings have lost their jobs, making it nearly impossible for them to pay their rent and expenses. Their father, Lewis, has been detained at the Tacoma Detention Center for over 2 years. He's seeking asylum, as well as waiting for a response on the Convention Against Torture application that he has submitted. Their mom has spent 2 years in asylum proceedings at the Eloy Detention Center. Her case is now at the Ninth Circuit Court of Appeals, but unfortunately, she has been deported 2 months ago back to Mexico while waiting for that decision. These young adults have been highly responsible. They're caring for each other. They're trying to do the right thing, working and going to school. And unfortunately, they've just been separated from their family, but they're trying to keep hope alive. Through our emergency fund, we were able to help them out so that at least we can help them stay in their home and stay together during this crisis.
Yeah, and I just want to share a couple of stories from our Children and Family Services side as well. You know, our families struggle in the best of circumstances when they are reunified. And so this COVID challenge has just provided additional kind of obstacles that we are helping them to overcome. So we have a young girl named Natalia who's 12 years old. She's from El Salvador, and she just reunited with her mother. And her mom is actually pregnant and is unable to work as a cleaner because of the COVID-19. So many people have canceled their service that the company has had to lay folks off. So she's been without work for about a month. And, you know, one of her biggest concerns has been not only financial, but also Natalia's learning English. She's, you know, hoping to now be enrolled in school, and this, you know, public health crisis has caused the schools to shut down. So with the support of her caseworker, Natalia was connected to school resources, and we were able to actually secure her a laptop that allows her to connect with her teachers through Google Chrome and Google Classroom, so she can continue learning English and getting to know the classmates that she will rejoin once the schools open. One of the other real benefits I think that we've been able to help Natalia with is she's not able to go to her therapy appointments because of this crisis. And so we were actually able to help her to secure the technology that she needed to be able to continue teletherapy. And that's something that would have not been possible had LIRS not been there to sort of help navigate this really complex situation. And, you know, just to show the amount of trust that these families put in to LIRS, we've actually helped them navigate some low-cost, no-cost health clinics, a local food bank, you know, anything that we can do to support them to get them through this time. And Natalia recently told her caseworker that she hopes to be a doctor so that she can step up in service in times of need, such as the one that we're in now. We're also serving 2 young brothers from Guatemala whose mother works at a company who has recently let people go. And she had a real concern about her children because they generally eat 2 meals at school. And so their caseworker was able to sort of help them get connected to the school lunch program and the food bank, as well as get them computers so that they can stay connected educationally. And right now, the mom and her children make 2 trips to school to collect their meals. And they really feel like it's something that gets them out of the house in just a safe way. And it's actually kind of bringing the family together. But the concern for the future remains really very much there. And LIRS will be there to support that family as they face the unknown.
Yeah, thank you, Lori. Makes me think also about the types of things that our partners and that LIRS is doing on the ground. We're definitely visiting our families, but we've decided to call them porch visits instead of home visits. So we're still seeing our clients, but not, you know, at a safe distance, and calling them regularly to check in. We've dropped off thermometers for our elderly clients, and I've sent out CDC mailings for clients that have been here for the last couple of years. We're sending out care packages to families and helping families get the technology they need in their homes so that their kids can attend classes as required and they can communicate with their case managers. And then lastly, we have been providing some emergency assistance as needed for people who are really in dire straits. We have also seen our clients stepping up to help their community, which is always really heartening to see. In Lancaster, Pennsylvania, one of our Somali families is delivering groceries to the elders in the community and checking in on people and making sure they're safe and healthy. And I would not be surprised if this is happening all over the place, all over the country.
Yeah. And we in Children and Family Services have also had to get creative in how we serve our clients and our kiddos and their families during this time. So for our kiddos who are in our foster care programs, we've actually been able to move to teletherapy and case management and make sure that each of the kids and their families have access to the technology that they need to be able to participate in those vital services with us. We are also doing virtual home visits, so we're actually able to talk with the parent, maybe who's a potential sponsor, and see the home all through a virtual way. We are also supporting distance learning, so we've had to close down our transitional foster care schools as well, and we've created sort of a learning environment for our teachers and our foster parents to be able to kind of have support in each other, but also have access to some resources on distance learning. We're providing our foster parents with additional support as well. Just like everyone who's staying home with their kiddos, we want to make sure our foster parents who now have their kiddos who are staying home instead of going to school have everything that they need to be successful. And finally, I would just say, you know, in some ways, this pandemic has changed everything, and in other ways it has changed very little. For our kids in foster care, family reunification remains our priority, and we've had to really go to some real alternative ways to ensure that reunification continues to happen. So we used to be able to easily book a flight, and our staff would board that flight with the child to take them to meet their parent for reunification. And now there are lots of travel restrictions. So our staff has really stepped up, and we have stories of staff driving 8 hours one way to make sure that the child can be reunified with their family. And so, you know, for us, that hasn't changed, and we won't let anything change that or stop our resolve to ensure that children and families get the support that they need during this time.
Yeah, and I would just say that in addition to being impressed by all of our team and their work that they're doing, our clients continue to impress us with their resilience and their strength. And we continue our work of running towards the crisis at hand, even if we have to do it at a safe distance right now.
Thank you, Megan and Lori. Hi, I'm Ronette Asirvadam. I'm the Advocacy Director at LIRS, and I'm going to focus on how we do advocacy at this time of COVID-19. Right now, we're focusing on two aspects. One is oversight. During this time of an emergency like this, the administration issues many regulations and many orders. Some are good, some are bad, but mostly all are confusing. So we push the Congress to use their oversight powers to get more clarity on these regulations. For example, the southern border has been ordered closed, and unaccompanied children are currently not being given refuge. We are pushing Congress to ensure that this order and practice is in keeping with US laws and US values. We know that even though things are looking bleak right now, that this too will pass. And when we come out on the other side, we will be much stronger. But we also need to make sure that we will not forget our American values of welcome. This is why, even in a crisis, oversight matters. The House and the Senate are doing their oversight. They are sending much letters, asking many questions on this border closure, and they are helping us as organizations be able to support all vulnerable communities, both in times of crisis and in times of calm. The second way that we are doing advocacy is that we are trying to push legislation which supports refugees and immigrants as well as other vulnerable communities. I'm sure you've all heard of the stimulus package, officially known as the Coronavirus Aid, Relief, and Economic Stimulus, or the CARES Act. This was passed on March 27th. Many have asked if there is a support for refugees and immigrants in that package. And the short answer is yes, but to varying degrees. The first test to access support in this package is generally to have a social security number. And then from there, each aspect of each relief measure has its own criteria. So for most part, refugees and immigrants will be able to access the cash payout of $1,200 per individual, and refugees like Henry, who Megan mentioned, will be able to access unemployment insurance. But then again, there are gaps. There are many populations of refugees, immigrants, and even citizen vulnerable communities who have been left out. So our work is not done yet. So the question is, how are we going to fix it? First of all, we'll be looking at administrative fixes. The beauty of doing advocacy for an organization like LIRS is because we can be on the front end of the policy, working with Congress, and then through our programs and service provision, monitor its implementation. So we can go back to the administration or Congress and say, this is not working, here's the fix. The ability to see policy in action gives LIRS advocacy a lot of gravitas here in DC. Second, of course, we're looking at another bill, hoping for another legislative fix that would provide relief for lots of people. And third, we are looking to you and asking you to raise your voices, especially on the issue of inclusion. The biggest gap in the coronavirus stimulus package is that not all refugees and immigrants can get testing and treatment for COVID-19. If this pandemic has taught us anything, it is that we are all in this together. Something that affects any of us affects all of us. So I ask you, please use your citizenship, use your voices, and uplift the rights of others. Click on the link on your screen and email your congressperson, asking that all who need it can get tested and treatment for COVID-19, ensure the most vulnerable communities get the economic support they need, and also release all immigrant families in detention. So please take this action now or after this webinar. It will make a great difference. Thank you, and I'll hand it over to Tim.
Thank you so much for that, Ronette, and really thanks again for everyone who took the time to join us today. My name is Tim Young. I'm the digital marketing manager here at LIRS, and today I'm going to talk specifically about immigration detention and what we can do to send help and hope to our friends in detention. Unfortunately, what we're seeing in detention centers is really a recipe for disaster. Right now, there are more than 35,000 immigrants in detention facilities across the country. These facilities are notorious for obviously crowded confinement, poor or inadequate medical care, and just conditions that make the spread of disease much, much easier. Even before the coronavirus, we've seen this play out. This past summer, there was actually an outbreak of mumps that made 1,000 immigrants in detention sick in 57 facilities across the nation. So frankly, we're very worried. We're worried about the mental and physical well-being of our friends in detention, because already just to be held behind bars for nothing but seeking a better life, that's a traumatic event. But to be held in these dangerous conditions while there's a global pandemic, it's especially troubling. So the CDC has actually directed guidance to correctional facilities, asking them to provide a no-cost supply of soap that would be sufficient for frequent hand washing. Oftentimes, immigrants only have maybe 1 bar of soap per week, which might not be enough given the amount of hand washing that should be happening. But by all accounts, we haven't really seen that CDC guidance being implemented in any really significant way. So obviously, we're worried. We're hearing that detainees have to use their own commissary funds just to get the soap that gives them a fighting chance at staying healthy. In other cases, we've seen migrants stage protests, engage in hunger strikes, really just in the hopes that they might find some better conditions, whether it be additional hygiene supplies or securing their release. Obviously, this is a desperate situation. So is there any reason to be hopeful? There's a few examples of immigrants who have been released, mostly due to lawsuits that have been filed in California, Massachusetts, most recently. mostly for immigrants who have serious underlying medical conditions. So there's a little bit of a silver lining there, but obviously we haven't seen the release of immigrants in detention on the same scale that we've seen in the domestic penitentiary system. We've seen places like New Jersey, New York, even Texas release thousands of convicted but nonviolent offenders. So, we're talking to lawmakers, as Renette was saying. We're talking to really anyone who's willing to listen. Ultimately, the decision of whether to release migrants in detention is up to ICE. So that's a big reason why we've launched our newest campaign, which is called Hope Can't Be Quarantined. Because if we can't physically get them out, we want to do everything in our power to make sure that we're sending help and hope to our friends in detention on the inside. So the first thing that LRS is calling upon our supporters to do is actually to write to detainees. Anyone who's participated in a pen pal program or have visited a detention center, they know what a dark and really isolating place it can be. So I just can't stress how important it is to let these people, and that's what they are first and foremost, people, human beings. We got to let them know that they haven't been forgotten or abandoned at this time of need. I personally have been thinking a lot about a man named Alejandro, who's being held in a Washington State facility. He had written back to us after our Hope for the Holidays campaign, which many of you, I'm sure, participated in back in December. He was just so moved by the fact that he hadn't been forgotten that he actually sent us a letter and a poem entitled Alien 456. And I think that just really highlights how dehumanizing the experience of immigration detention is. And that what he was most desperate for people to know is just that he isn't a number. He's a human being like all of us, simply yearning to be free. So please don't underestimate the power of showing compassion, of engaging in some human connection, because it's very important for people who might not have any contact with the outside world now that all social visitation has been suspended due to coronavirus. We're also asking people to donate to support this mission of detention visitation. These programs are an absolute lifeline for immigrants in detention. And the programs and volunteers and people who are involved are really in a position to fund the commissary accounts of our friends, which will allow them to get access to hygiene supplies and soap and the things that they need just to have a fighting chance of staying safe. We're also asking people to educate themselves, educate yourselves and others about immigration detention in the US. For those who don't follow the issues so closely, they might be shocked to know that the majority of people in ICE detention have never been convicted of a crime. They might not know that 6,000 asylum seekers who have actually passed a credible fear interview, meaning they've established a legitimate fear of returning home, they're being held behind bars, really simply just for seeking a better life, as is their legal right. And I'm sure a lot of people don't know that it wasn't always this way, that up until the 1980s, we almost exclusively favored alternatives to detention. So I really encourage you to go to our website, check out our blog, check out the campaign, because there's a lot of resources that are going to be useful, not just to know where we came from, but where we can go to be a more welcoming nation in the future. Another part of the campaign is really sharing. Obviously, we're physically distanced, so we're really relying on social media to bring us closer together. So if you've written a card to a detainee, a poem, a piece of art, share it online. We're using the hashtag Hope Can't Be Quarantined. So if you've done something like that, or if you found one of our educational resources to be particularly insightful, share that. And of course, if you haven't already, be sure to like our pages. We're on Twitter, Instagram, Facebook, and that's one of the major ways that we keep everyone up to date. Also within that toolkit, we're encouraging people to really reflect and pray for migrants in detention. You'll find some suggested prayers inside. So we really encourage you to take advantage of those, especially given that for many of us, we can't physically, be in the pews these Sundays. And on that note, I'd also like to flag, outside of the Hope Can't Be Quarantined campaign, we also have some excellent resources for congregations in our ministry resource library. Go to lirs.org, you'll see in our up top on the tab under resources, you'll see the ministry resource library. I believe the link is also on the slide there. So, even if you can't get to church, we have resources, we have prayers and reflections for the season of Lent. We have commentaries from migrant and refugee faith leaders, adult Bible studies, and more. So check out that page whenever you get a chance. So again, thank you for taking the time. Thank you in advance for any way you choose to participate in the Hope Can't Be Quarantined campaign. Thanks for any contributions you can make, whether big or small. It does make a big difference. And thank you just for really thinking of other people during this crisis. So with that, I think we'll move on to our Q&A session. If you haven't already, they're on the sidebar. You should be able to see a module with questions. So I'll give it a few seconds and see if any questions come in. So just bear with us for 1 minute. Okay. All right, I think we have a good question here for the programs team. The question is, how are you getting information to clients right now? Is it challenging finding resources in another language? How are you going about that? Megan and Lori, you want to take this one?
Sure, I can start just with a little bit of information about that, because that is a huge concern, and we want to make sure people can actually read the information that we're sharing. So early on, when this first was coming out and there was information that we wanted to share from CDC, we did work amongst the 9 national resettlement agencies to translate the documents into as many languages as we could. And then we shared all of those resources with our networks across the country so they could provide basic information that all Americans at that time were getting about social distancing and washing your hands and how to take care during this time. And then otherwise, most of the materials we've been able to easily translate, and almost all of our staff are bilingual and speak the languages of the clients that we serve. And so it's not been a major issue for us to get that information out to them.
And I would just add to that, that when families are coming forward for the reunification process and they go to our safe release sites, we're making sure that we're giving them information about COVID and guidelines and how they can keep themselves and their children safe at this time in their native language. So that's been helpful as well to try to reach people in that way.
Okay, great, excellent. Thank you for that, guys. I see a question here. How can members of congregations send letters to people in detention? I'll field that one if you don't mind. So as part of the Hope Can't Be Quarantine campaign, if you download the toolkit, I believe it's on the 3rd page, we have a list of our actual delivery partners. So each one of them have some special instructions. So for example, if there are any particular languages that they're seeking, we also have some translations in there. For example, you need some inspiration for some common Spanish phrases. Google Translate is also another great resource for writing more personalized messages. So within the toolkit, you'll see which address to send it to, if there's any specific considerations you should take. But yeah, it's all there in the toolkit. So really encourage you all to check it out. If you need an activity, you're stuck at home, writing to people is a really good way to care, and that they haven't been forgotten. Okay, oh, we've got a lot of things rolling in. Let's see. Is there any information on unaccompanied refugee minor or unaccompanied child referrals and/or restrictions?
Yeah, that's a great question. So unfortunately, because no refugees are able to travel at this time, that also means that unaccompanied refugee minors from overseas are not able to travel at this time. So we will continue to work closely with folks to try to really ensure, particularly those kids who are going to age out, that we try to do everything we can, but with all travel stopped, that does include children coming from overseas.
And if I can just add to that, this is of utmost concern to LIRS because We are one of only 2 resettlement agencies that actually take care of unaccompanied refugee minors. And so even before the pandemic hit, we were deeply concerned about what allocations would be created to ensure the continuing admission of unaccompanied refugee minors. And so even after we get out of this public health crisis, we hope that you will stay engaged with us, because there needs to be advocacy to raise this issue of children who are fleeing the most desperate of circumstances. And unfortunately, based on the sort of trajectory we are headed, we are deeply concerned that down the road, there will be very, very few admissions, if any, of unaccompanied refugee minors.
Great, great. Excellent. We have another question here. I think, Ronette, this is going to be for you. Is it true that you need to have filed a 2018 tax return in order to get a stimulus check? What does this mean for mixed status families?
So you don't know, it will depend. Again, these answers, this bill is very complicated, and its implementation is still in stages. So right now, from what we know, is that if you regularly file taxes and you have filed either 2018, or if 2019 is the first time you're going to file taxes, or you're qualified to file taxes, as long as you meet all the other specifications of this, yes, you could file tax. You don't have to have 2018 only. You can start with 2019 if that's where you're starting. But it is a lot more. There are, especially for refugees and immigrants, there are a few more qualifications that need to go to. And so we would say, talk to us or talk to someone. If you're a refugee or immigrant, make sure, don't go ahead and just file, because there are several aspects and layers to this. This bill is a tax bill. And it has been quite a conundrum for lots of us. And we are still working through it. So make sure that you talk to someone, especially if you're a refugee and immigrant, and you haven't filed taxes before, without rushing to file a tax return now. So that's the first part of your question. The second part is, what about mixed status families? That is definitely an issue. What the Act says now is that everyone who has a social security number will get the stimulus or get the cash payout. But the problem is that if you have filed jointly, if you have filed before this jointly, and only one person has the social security number, then the entire family, or the 2 people, are exempt from getting the stimulus. So that is a serious issue, that mixed status families, even the person with the social security number, will not get the cash payout because of this. So it's something we're working on.
Great, great. Thank you so much, Ronette. We have another question. This one is LIRS says, I'm sure LIRS has other goals and initiatives that are probably on hold during the pandemic. What would you like to get back to most once the majority of the pandemic has passed? Krish, why don't you field this one?
Sure. I think we all sort of dare to dream about a time when we're not holed up in our homes. And for us, I think learning from this experience is going to be critically important. Part of that will be thinking about how, even this issue of detention has come to the forefront, because we're obviously looking at what an extreme situation this could be if we have COVID-19 in a concentrated population. But honestly, LIRS has been advocating for alternatives to detention well before the pandemic. We know it's a more humane alternative. It's better for the individuals. It's better for the families. It's better for the taxpayers. We've been working on these kinds of programs for well over 3 decades. And so we'll continue to look back and say, this is just one of many reasons for why alternatives to detention are a better option to the mass incarceration of immigrants. We'll also be looking back at the role and contribution of immigrants during this time. The fact that immigrants are on the front lines as medical providers, as aides in senior living facilities, as workers, plucking the fruits and vegetables that we are so dependent on right now. And so I think that this will be a moment for us to shine a light on how this is a nation that has largely been built on immigration, and that is a strength and not a weakness. But then, of course, we'll be looking at some of our other programming. Workforce development is something that we've always taken very seriously. Obviously, as we get out of a recession and look to taking, having millions of people go back to work, we'll be continuing our public-private partnerships in that area of work. So while it feels like a very busy time right now, we know that, after this passes, we'll be hitting the ground running in many different directions coming out of this.
So great. Thank you so much for that question and for that answer, Krish. Our next question is for Renette. The question is, can you say more about how the border closing is affecting asylum seekers?
Yes, and in one word, it's affecting them very badly. So the border closure makes sure that asylum seekers are also not allowed in. This is a problem. This is of great concern to us. And of course, everyone is trying to see if this goes against our laws, especially the Torture Victims Protection Act and certain laws and obligations that the US has in terms of protecting people. So that is where things are at the moment.
Okay, great. And a follow-up question, because I see another one a little bit related to that. What specifically would be your top asks for new federal legislation? Do you have any more insight into that, Renette?
Sure. So in the fourth package, we're hoping that there will be a fourth package. And in that one, the top ask is definitely that all who need it can get testing and treatment for this COVID-19. We know that it's not going to go away right now. The second would be funding, both expanding the funding mechanisms, both for general relief measures, so like unemployment, SNAP, any of those relief measures, and then definitely expanding funding for services for refugees, especially who have arrived recently. Those would be the top three.
Great, excellent. I see a question here. Someone said, I noticed the Amnesty International's logo on the webinar. How are you working with Amnesty International USA? Good question. So when we launched the Hope Can't Be Quarantined campaign, and we've worked alongside Amnesty International before in the past, they were really interested in joining the campaign, essentially. So we worked together to create sort of a co-branded version of that, and they're helping us through their network to promote the campaign as well. So we're really hoping for a lot of cards and a lot of support for for our immigrant friends in detention. So we're very grateful to be collaborating with them as well. So thank you for that question. Let's see. Oh, I like this question. On a more personal level, how are you at LIRS managing your own stress while continuing your efforts to help people? And I see a similar question. After a long day of work, what are you doing for self-care? Taking up baking, good shows on Netflix. Maybe Megan, do you want to field that one?
Sure. Yeah, I think we all have to be thinking about how to take care of ourselves and helping other people remember to do that as well. So for me, I do have a 18-month-old daughter around the house, so she keeps me pretty busy, but I do try to escape for a little bit of me time and do some yoga. I have my yoga mat rolled out right next to me here, and I try to get some stretching in and just move my body a little. Getting outside, I think, would be my other go-to. Just getting out. Luckily, the weather is kind of turned towards a little bit nicer these days, and so it's been great just to get outside when I can.
Great. Excellent. Okay, let's see. I don't know if we have an answer to this question. Let's see. Let's take a shot at it. What resources are in Mexico when children are deported? Someone can speak generally. Maybe Lori, do you have an idea?
Yeah, I mean, I think, that's really one of the challenges, is that there are not a ton of resources. There were not a ton of resources before this health crisis. And, organizations have had to make decisions around, how they continue to support at the border. And I think everyone, kind of like Megan said, we want to rush into this, not run away from it. But the reality is that resources remain really scarce. And so that's one of the reasons that we are really advocating that, this idea of turning children away at the border is not the right thing to do. But, resources are quite limited.
And if I can just jump in on that, only because I went to the southern Mexico-Guatemala border just before the Christmas holidays. And it is an interesting shift in Mexico, because I think that they are realizing that between, the Remain in Mexico policy, metering, that obviously the opportunity to come to the U.S. and to exercise your legal right to seek asylum, no longer exists in the way that it used to. And it is interesting how the Mexican government has started to increase its capacity to absorb in even the kind of limited fashion that a country like Mexico is able to do. So COMUS, C-O-M-U-S, their agency that works with children, is taking this responsibility seriously. But one of the things that LIRS has actually been looking at is how can we provide care to deportees internationally. I think many organizations think of that as just such an unfortunate result, that the goal is to provide as much access to justice, et cetera, here in the US. But we realize that with some number of children and families, they will have no choice but to return. And so our hope is to be there to help support their reintegration.
Great, thanks. We have a question here. I heard members of Congress are in their districts now. Should we call their district office with these asks? Renette or Advocacy, do you have?
Yes, that is definitely a good idea. They are in their districts, and so please do call them in their districts. That would really work and help us.
Great, thanks. Okay, let's see. I think we have time for a few more questions. Let's see. Having some audio issues. What kinds of testing and treatment limitations are being put on immigrants right now? And a follow-up question, somewhat related, but not necessarily. Will COVID-19 in any way affect the DACA program?
So the first question, in terms of testing and treatment, so there are two limitations that are not very specific. So in terms of this bill, in terms of this act, the CARES Act, what has happened is it refers to other immigration acts, the acts of 1996. At that time, so what that does is it prevents some immigrants and refugees, so basically refugees who are here with a green card, but in their first 5 years of having the green card, and other immigrants from getting testing in private organizations or through Medicare, basically, from getting testing through state Medicare. That's the preventive measure, and it's not specific in this bill. It's just because it goes to a different bill. But that's the first prevention. The second one is clearly the enforcement. There are lots of the ways that many immigrants can get this testing and treatment is through the community centers. And we know that ICCBB have not said that they will not enforce and not arrest anyone. So those are the two ways that there's testing and prevention issues. And so we need to have a commitment to say that everyone will have testing and there will be no barriers to this. That's the main way. And the second question was the DACA question. The DACA question, COVID per se, except for DACA renewals and the fact that many USCIS offices are closed. So renewing your DACA is a problem, and there isn't an automatic renewal. So except for that, COVID won't affect DACA as much. The problem is that we are expecting a DACA. We are expecting the Supreme Court to rule on DACA soon. So that is everyone is waiting and worried about that.
And if I can just jump in on that point, because I do think it's not a silver lining, but I think it is interesting to your question about the impact of COVID-19 on DACA. 29,000 healthcare providers are DACA recipients and are at risk of deportation if there were a negative decision. So if you haven't seen it, there's a very good op-ed that was written and published by healthcare CEOs, executives, yesterday in the New York Times, basically advocating that if anything happened on DACA today, it would take tens of thousands of medical care providers who are providing life-saving care off the front lines.
Great. Thanks for that. And we have two related questions I think are a good note to end on. The question is essentially what precautions are being taken in essentially shelters for children, for refugee children, given that there might be challenges in having less than 10 people or distancing 6 feet apart. What types of precautions are being taken there? And also, are there any plans working on releasing unaccompanied migrant children, releasing them to their sponsors, expediting that process given the urgency of COVID-19?
Yeah, those are great questions. LIRS doesn't have any large facilities. So for us, it's been about ensuring that our foster parents and that our small programs are able to abide by sort of the stay-at-home guidelines. But ORR has issued some guidance for larger facilities in order to ensure that children are kept safe. And in terms of reunification, we are always doing everything we can to ensure that children are with their families as quickly as possible. And one of the things that can, sometimes pose a challenge is a family needing to step up to get their fingerprints done and to be able to go through the sponsorship process. So we have really made a commitment to ensuring that families can access our safe relief sites whenever possible at as many locations as we can, as well as our case managers are really working in overtime. And in some ways, the remote case management has allowed them to do this because they're cut down on the travel time going from home to home. And it's given them an opportunity to spend more time walking families through the reunification process, which we hope will help speed up getting families from their foster family to their birth family.
Great. Thanks so much, Lori. And with that, I'm going to invite Pastor Sharon Baglios to close us out in prayer.
Thank you, Tim. And I want to thank all of those who are listening today. We are grateful that you made time to be informed during this webinar. We are grateful for the offering of your time and your many gifts in response to God's call to welcome the stranger. This past Sunday, many of us joined worship online, where we heard the story of Martha and her sister Mary, who were distressed as their brother Lazarus was ill, very ill. They sent for their friend Jesus, but before Jesus arrived, Lazarus died. As Jesus approached his friends Martha and Mary, he learned that they were in anguish, grieving their brother. And Jesus wept. Jesus wept for the sisters, and he wept for himself in grief for his friend. Martha and Mary went with Jesus to the tomb where Lazarus had been laid, in an act that defied human reason and foretold his own victory over death and the grave, Jesus called to Lazarus, "Come out." When Lazarus appeared, Jesus ordered those standing nearby to unbind him and let him go. That is, release Lazarus from all that bound him to death and decay. We are left to imagine the relief and the joy that swept over Martha and Mary as their brother was restored to them, alive and whole. I invite you to join me as we pray to the one whom we believe comes among us when we are frightened and in despair, with presence and power, and with the promise of new life and joy restored. Loving God, creator of all, we thank you for the gift of the human family, for sisters and brothers, for parents and children, for co-workers and neighbors, for the young and the elders, for friends and those we have not met. We lift before you all those who are in distress this day and ask that your presence and power might surround them. Protect children who are separated from their families. Calm their fears and supply their needs. Sustain those whose work is uncertain or dangerous. Come to the aid of those who have lost their jobs. Watch over those who are alone and isolated and do not know what their future holds. Strengthen and encourage those who serve, nurses, doctors, caregivers, grocery store workers, police, and firefighters, and all who labor in this time of stress. Give wisdom and foresight to our leaders and elected officials. Heal our world, heal our bodies, strengthen our hearts and minds, and in the midst of turmoil, give us hope and peace. Release us from this time of trial, that we may witness to the hope of grief becoming joy and life rising from death through Christ our Lord. Amen.
Thank you so much, Pastor Sharon, and thank you to everyone once again for your attendance. We are going to make the recording of this webinar available on our website. So if you want to watch it again or share it with your wider network, it'll be up on our blog, and we will also send an email out to all who are registered. So thank you once again, and have a great day. Stay safe.